All righty, take two, take two. Welcome to Wellness Wednesday with Coach V. And we also have Hepzibah Beulah, the RN of Lady of Faith Wellness, better known as the what? Patch Practitioner. We are going to go ahead and share first to our pages, and I'll be right back. Let me go ahead and share really, really quick here. I think I could share from here. If not, let me go back out of here right quick and share. Let's see here. Okay, I am back. I was able to share. Again, like I said before, welcome, welcome, welcome. You are with us with Wellness Wednesday. We made it once again.
Woo woo!
We had a little technical difficulties, but we made it. We made it. Today, we are going to be talking about three of the patches as it pertains to ADHD, anxiety, stress, autism, things like that, that really aids and assists people. And so I think it's very important because in this day and season, anxiety and stress, i.e., me, I'll talk about it first, right? Is one of the things that sometimes I personally deal with, right? And we have some patches that are, listen, has come in and saved the day. I'm gonna tell y'all, I have on all three of them right now. I had to. This morning I was just like, oh Lord. So I have on one, two, three, I have on six patches today. And that's the great thing about it is that we can layer up, right? Because some days we need to. Some days I wear three. Some days I wear five. Some days I wear six. It's just back and forth. Depending on what your need is, we have a patch for that. All right, Hepzibah, you take it away. Let's talk about it a little bit.
Well, good morning, everyone. I am Hepzibah Beulah, the patch practitioner, and my niece affectionately gave me that name, and it stuck, and I love it. So, and thank you for having me on again this morning, sis, as we talk about those patches for anxiety, autism, ADHD, the symptoms of, so we want to make sure we say the symptoms associated with anxiety, which would be the elevated heart rate, sweating, nervousness, feeling sensations of stress, butterflies in the stomach, panic attacks, different things like that. Um, so one of the things that I want to make sure that I reiterate before we even get started on the patch, number one, two things. One is that Super Patch Company does not profess to cure, heal, or treat any of the things we just mentioned: ADHD, autism, anxiety. What was a couple of the other ones?
What did I say? Stress,
Okay,
anxiety,
okay.
ADHD, autism. Yeah.
So these devices, i.e., patches, are designed to aid and assist, and they do a very, very good job doing it. Phenomenal testimonies. And the second thing that I want to say is, with all of these diagnoses, the ADHD, the autism, the anxiety, especially if they are diagnosed, okay? If they have been diagnosed by a pediatrician or a physician, or ladies, your OBGYN may have prescribed you some medication for anxiety, we definitely let me say, I am highly requesting, suggesting, and recommending that you stay in communication with the person
Mm-hmm.
or the physician or clinician that may have put you on medication. It's very, very dangerous to abruptly stop certain medications that are used to treat ADHD, autism, and anxiety. Okay? So the sudden cessation or the sudden discontinuing of these medications can have very, very serious implications.
On the physician
And,
or the
and so,
physician that may put you on medication can have
oh,
Sorry about
serious.
that. Hold on. Okay, go ahead.
okay. So that's one of the things, especially with a child, with children, pediatrics, which that can be from ages, 1 day to 18. That's considered pediatric, or right under the age of 18. So we want to, because the brain is developing so rapidly, okay? So if they're already on medication, you don't want to suddenly stop it simply because you apply the patch and you get phenomenal results and gratification, okay? So I just want to make sure that I highly, highly emphasize that. So that being said, with ADHD and autism, you may struggle, especially with the ADHD, with the child or the adult, because there is adult ADHD, may be struggling with focusing, accomplishing tasks, completing tasks, staying on task. For the child that may be in school, they may, moms may, or dads, parents may get a lot of calls from child is not focused, they're distracting other students, not completing their assignments. Maybe anything from twirling pencils to frequently getting up and down out of the desk, can't sit still. And I know how that can be for the parent. I've talked to, I don't have any, but I've talked to parents that have struggled with that. And so these patches are such an asset to you to aid and assist in those types of symptoms. So let's talk about the patches and incorporate the patches that you have, as we talk about these different issues.
Absolutely. So the first one you talk about is the focus. And I want to go kind of back up and reiterate what she says. That's one of the things that's so important, that we patch and we work with our practitioner. We work with our doctors. We work with our therapists, whatever we do. We're not saying don't do that. Listen, we patch, we pray, we listen, and we go to the doctor. I'm just saying, right? It's very important that we do that, because I don't want anyone thinking, oh, I could just substitute this for that. No. You're going to make sure that you study going to the doctor. You're still going to your therapist, whatever the case may be, and let them do the dial back, not you. Let them do the dial back. But for us to focus, you talk about the focus when you're in classroom or even as adult. I have on the focus patch today myself. Okay.
It's right here.
Absolutely. Yeah. I have it on as well. Like I said, I have on 6 of them. But yeah, I have on the focus patch. For one, Wednesday is my meal prep day. And when I have big orders, I want to make sure I'm focusing on making sure that I'm hitting, making sure I'm making this correct. I'm not messing this up. So that focus patch is, it's a wide range of things that it can actually assist. I always like to use the word assist because that's what it's doing. It's assisting me to focus better. It's helping me, aiding me to, do things. And so that first patch we want to talk about is that focus patch. I absolutely love it because it works. Mm-hmm. It really works. On Saturdays when I go vend, when we have several customers and I'm the only cook on the grill, I've got to focus on making sure I'm getting their order right and I'm moving fast. It works for me. Mm-hmm. So I've tried it, and I know that it works. It's really good. What about you, Hepzibah? And you said you have on this one today as well, right?
I have that one on. And the main thing I want to say for myself, because everyone's experience is going to be different.
Right.
Most people are going to experience the instant gratification. And so when I say most, statistically, 80 to 85%, okay, mm-hmm. within 20 minutes, you're going to feel it. Some people, they may have to wear it up to 2 weeks. That's the recommendation for all the patches. Give it up to 2 weeks, wearing it daily. So I do, but 80 to 85% of people get it within 20 minutes. And it does what it says. So what she's talking about, being on the grill, or for somebody else, it may be if you have quite a few tasks as an adult that you need to complete, and for the child, it's going to be those 6 hours there in school, have to sit in a desk and listen to somebody. It's very important that they would be able to stay focused, because what it is, especially if they already have a diagnosis, then you don't want them because they already have a diagnosis of ADHD, or they're on the spectrum with autism or what have you. So they already have a diagnosis. So we don't want them to get labeled as disruptive, as class clown, as, uncooperative. because we talking about the brain and the maturation of the brain and the growth and development of the child. We don't want them to develop, what's the word I'm looking for? We don't want them to develop,
discipline issues, or what word?
no, not the discipline. We don't want them to develop the word escapes me, but we don't want them to develop a complex. We don't want them to develop complex, and we don't want them to be labeled. So the focus does just what it said. It's not really that much to say about it, except that's what it does. And I know you probably, do you have peace with you?
I do have peace.
Okay. So
I have it on too.
I would like to segue into that, because with the ADHD and the children on the spectrum, and it's even the adult ADHD, these two together, okay? Because a lot of times the child may be fidgety, okay? They may be, like I said, get up and down, frequently getting up, have to be redirected by the teacher or the para. So the peace is going to calm them down, and the focus is going to hone them in on the task. So that's why that's a great combo, especially for pediatric ADHD children under 18 and on the spectrum. It's going to focus them and it's going to calm them. And between that combo, they will be able to complete their task, do their, not be disruptive in class, not be a distraction and what have you.
Absolutely. And so like you say, these two together is going to bring them down. Like, and I notice it's like some days if I feel like I'm just like overstimulated is the word for me. And I just be like, oh my goodness, especially if I feel like I got a lot to do today and I'm sitting here saying, oh Lord, how am I going to do this? Oh, I said, hold on, put your 2 patches on. And so I put them on and it calms me down. Mm-hmm. And then now I'm able to put in, okay, let's do this first, Valencia. Mm-hmm. Okay, now let's do this. It calms me down, and then it helps me place myself right. Not only place myself, but pace myself. Absolutely.
Great. Pace, and place, and that's the whole idea. And so, since we have the peace patch, I want to bring in the anxiety symptoms. So the nervousness, anxiety. You can also be distracted as well, the panic attacks, the nervous stomach, also nausea. It's great for nausea. Sometimes when you are anxious, you can feel symptoms of nausea or the butterflies. And so that, for me, is the instant gratification, is the immediate calming down of the nerves, the nervousness in the stomach, the nausea, the increased heart rate. When you get anxious, you breathe faster, which is how people with hyperventilation is. They're breathing faster than the normal rate, which can cause you to pass out if you do it for a prolonged period. So the peace is instant gratification for that. Like I said, everybody's different, but in my experience, and it is almost instant, especially like of people that are in chronic pain. That's why we pair it with the pain patches, because as a stress relieving and calming to your nerves, the calming of those nerves also helps to relieve the stress associated with being in pain all the time. So the anxiety symptoms are definitely assisted by the patches almost instantly. And sometimes you don't have to, and I love the techniques that we do, the other modalities that we can do for anxiety, like taking a deep breath,
yes.
Saying something, but sometimes you don't have time. Those things, when you take the deep breaths, when you do the visualization, or when you play the music, you have to have time, or you have to find the space to be able to do it. And you may not always be able to get away to do those things. So the patch is going to give you that immediate gratification and that immediate stress relieving if you suffer with anxiety symptoms.
And this is what I want to add as well. What I notice is, because I use the focus patch, sometimes I put it on my arm, I put it, in my chest and different things. But I've noticed this. When I take this focus patch and I put it right by my neck like I have today, I don't know if you can see it. For whatever reason, when I put it there and I take a breath, it's like it activates it quicker. It could be a me thing. I don't know. But when I put it right there there, it's just kind of like, and it may be because it's close to my brain. I don't know. And that's me talking because I'm not a nurse. I don't know all the things, but when I put it there and I take that breath, it kind of centers me.
Mhm.
You know what I'm
Well,
saying?
one thing
And I don't know.
I'll say about that. I'm sorry to cut you off. Is
Go
with
ahead. Go ahead.
and this is with all of the patches. Sometimes you have to place them in different places to see where they work. In theory, you should be able to place them anywhere and they work, but that's not always the case. So if you have on any of the patches and you place them somewhere, because the Freedom is the only one that's placement specific, you're going to place it at or above the site of pain, and you can wear multiple patches. But with all the other patches, because you know why I say in theory you may have to change it, because your nerves may be healthier in certain places than others. So
Wow.
maybe your nerves are healthier there, or maybe they're more present, if that makes sense. Maybe you have more nerves there. Maybe because it's close to the spine, because it's the nerves that are picking up on the signal on the patch and sending the signal to the brain. So sometimes it does seem like the other patches can be placement sensitive. Okay, if you've had let's say if you have nerve damage in an extremity, okay, I wouldn't recommend that you put patches on the place you have nerve damage, okay, because the nerves are damaged. So the nerves are the part of the body that's doing the work. So if you have damaged nerves, then that may not be the best place, especially when you first start using the patches. As time goes on, you may, and you develop sensation or what have you, if you develop sensation, you may be able to apply it and get the same results. But just think about it. In theory, if it's the nerves that's sending the message to the brain, then you want to place it in a place where you know the nerves are nice and healthy and functioning.
Wow, that's good. I'm glad we talked about that because that makes perfect sense on someone I recently patched. So that makes a lot of sense now because I want to veer off just a little bit, but placement makes sense. Placement is everything. It makes sense. Even when we talk about when we're actually patching, say you patch here today, you may not patch in the same exact spot. You may go down a little further or go up, but you want to kind of, move them around so that nerve in each area, making sure they're healthy nerves. That's good. That's good. Now we talked about.
I just want to say that because sometimes and I do believe that people that don't get any gratification, that don't get results with the patches, I believe that they should. That's one of the first things the first thing they should do is make sure that the skin is clean and dry. If you have on even perfumes, or if you have on oils, or if your skin, if it's halfway the day that you get patched, your skin has already released its natural oils. It's already collected dirt and debris, dander, dry skin that's flaking. If you've put on anything, even some bath products are gonna leave a film on your skin. So making sure that skin is clean and dry. Recommend taking that alcohol pad and wiping the area and letting it air dry prior to applying the patch. So I believe that if a person is just not getting the relief or the results from whatever patch they're wearing, I personally believe it's either the condition of the skin or it's a placement issue.
Absolutely. Absolutely. Yeah, that makes sense. Now we talked about some of the symptoms and things like that. And what just came to my mind is that I have a son that when it's time to take a test, when he was in school, he would just be, he would result to throwing up. Because he was so nervous. Now I'm sitting saying, I wish I knew about the patches back then, right? Come here, boy, before you take your test. Come on.
Yeah. And even going to the doctor. Some people have what we call white coat syndrome. Their blood pressure is fine until they come to the doctor and it's skyrockets. And that's an actual thing, okay? So if you know your blood pressure is going to go up before going to the doctor, if you know you get nervous before a test, one of our business partners, Tracy, her daughter, cannot deal with needles, cannot handle. she took the needle like a champ, and she said she was so shocked at her. She's never seen her young adult daughter respond like that when getting a shot at the doctor. And
Wow.
so it's definitely calming and stress relieving, the peace patch, and the focus for the especially for exam time. Let's think about if you're a teacher and you got to take the GATE, some of these certification level, or standardized testing. Maybe your child is nervous and the school doesn't help sometimes. Really putting the pressure on so they can score the kids. So because it's reflective of them as professionals, and I definitely understand that. I'm not knocking it, but it's just a lot of our kids live in it's much different now for children than it was with Gen X. And baby boomers. We did not have half the stress that these children experience now with the advent of the internet and social media and so on and so forth, and technological advances. They're just exposed to so much now, so much more stuff they're exposed to. If we wanted to be exposed, we really had to go way out of our way to get access to certain things, and now they have it at their fingertips. So the parents and the child relationship is stressed. Parenting is more stressful, and being a child is definitely more stressful than it's ever been. So I love the idea that you can manage anxiety, distraction, hyperactivity with a patch instead of medication. And like I said, if you're already on medication, you definitely don't want to stop it. If you see that, stay in communication. And we'll get ready to close. I don't want to go too long.
Right.
But stay, especially with the children, please stay in communication. Let the physician or the pediatrician know what you're doing and that it's working. Share the information with them. There are peer review studies that talk doctor talk. It talks that talk. And that way the physician won't be anxious about. These physicians and clinicians don't know about Super Patch.
Right.
That's why we're on a mission to patch 1 million. And they are very skeptical. Anything outside of the way they were taught to do medicine, okay? They were not taught non-medicinal means. They were not taught holistic means. They were not taught about the impact of nutrition. They were not taught about these things. They were taught to prescribe medicines, to identify symptoms, and prescribe pharmaceutical to help with symptoms, or to do surgery, to do procedures. So that, and my OBGYN told me that. When I asked about a holistic mean to deal with fibroids at the time, uterine fibroids, he said, I wasn't taught that. I'm going to either write you a prescription or I'm going to cut you. It's one of the two. That's what I was taught. And they weren't even taught healing.
Right.
They weren't even taught. The doctor's mindset is not to heal you, it's to treat you. Okay?
And there's a difference.
They're not even taught that. So a lot of times clinicians get vilified, what the patch is doing stuff the doctor can't even do. The doctor was not trained to do what the patches do.
Absolutely.
So the doctors require educating too. So when you share that, hey, I put this device, this patch on my son, and now he's completing his task. I don't know a clinician personally that's going to say, I don't want your child using a patch that has no ingredients, that's not interacting with the prescriptions I wrote.
I can't hear you. I can't hear you. We can't hear you. Can't hear you. Oh, Lord, she's still talking. We can't. Can you hear me?
Yeah,
Let's see if she can. You hear me, Hepzibah?
Can you hear me now?
Something. Yes, I can hear you now. But you're so right. Before we go,
okay,
I do want to bring up.
I apologize about that. My phone was ringing. I didn't have it on do not disturb, so I apologize.
Okay. Before we leave here, I want to take
what was the last thing you heard me say?
You were saying you don't believe that there's any you said clinician, I think you said, right, that would say that they would not allow you to put a patch on your child that has no ingredients and there's no side effect, right, with their medication.
Especially if it's working.
Right. And again, that part right there, what you just said, is so important, because I've come into people that said to me, well, I got to check with my doctor first. And I said, okay, that's fine. I said, but there is no ingredients. Let them know there's no ingredients and there's no side effects. You know what I'm saying? Because why would they be against something that does not have a side effect and does not have an ingredient? But before we get out of here,
let me say this. This is what I say to people that say, let me check with my doctor first. I make sure they understand that the doctor, this is new to the doctor too. The doctor is not going to know what to say, because this is new. The technology is new. They don't know. So don't expect the doctor to say, because they're going to want to see the studies, and it's going to prolong your wellness. It's going to prolong you. And so you being the person, I'm not saying bypass the doctor. Y'all know I'm not saying that.
Right.
But I am saying that for you to try it, go ahead and try it and let the doctor know. You don't have to work. You don't have to get the doctor's permission.
Approval. Right.
You don't need a prescription for Super Patch. The reason you don't need a prescription is because there's nothing to prescribe. You understand what I'm saying? There's nothing to prescribe. Okay? So there is no ingredient, there's no pharmaceutical, there's no botanical, there's no extract. Even herbs can be toxic for you.
Absolutely. I'm so glad you brought that up. That is so true.
Even, and I know we got to go, but even botanical. So we're so, like I said, we're medicine and dose oriented. This is not a dose. This is not a medication. It's not a treatment. It's a neuro device. It bypasses your bloodstream. It bypasses your GI tract. It's the nervous system, the brain and the body working together. The nerve sending the signal to the brain, but it's not a placebo. It's not something it's not playing with your mind. It's rebuilding the neural connectivity in your brain that's been broken. So I just wanted to share that. So I would, as a registered nurse, I will tell you, I would not wait on my doctor to read over the Super Patch, to read over the 10 peer review studies, to read over, why? There's nothing to prescribe. There's nothing, if you are on 25 medications, if you take 10 pills a day, the patch is not going to interact with that.
Exactly.
Okay? Even if you start a new exercise regimen, it's highly recommended to consult with the physician before. Why? Because it's a physical, you can injure yourself.
Right.
Okay? So, but the patch is not even that. It's not even that.
And
so
that's
B knows if it was something you needed to discuss with your doctor first, I would be at the front of the line telling you, yes, there's nothing to discuss.
Absolutely. And that's why I'm so thrilled that I have you to back me up. Like, that's why I'm so glad that we do the Wellness Wednesday, because some people have questions like that. They're like, well, what if I have a medication? What if it's going to give me a side effects? Is it going to mess with? And I say, no, it's not. You know what?
And not even just the medication. Defibrillator. If you wearing a defibrillator, if you have a defibrillator inside of you, okay? And a defibrillator is a device, it can be external or implanted, that shocks your heart if it stops. Like, you don't get more serious than that.
Right.
Okay, so if you got a pacemaker, if you've got a artificial valve, anything, if you've got a shunt in your brain, if you've got a diabetic device that monitors if you got a infusion pump that's easing it doesn't matter what you have. That's the beauty of this patch.
I hope y'all are eating this up, taking in, hit the share button, because this is amazing conversation that we're going to always have every Wednesday. Every Wednesday. We did not get to our third patch, but real quick, I want to just talk about it real quick, which is Joy. And the reason why I want to, before we close out with Joy, it is one that is dear to my heart because I know someone recently that probably could have used this patch. Because when you're dealing with anxiety, depression, right? You need some peace, but you also need some joy to get your brain thinking a different way. And I think it's so important, like you said earlier, Hepzibah, which is so important, that our children are dealing with way more than we dealt with when we were kids. They're dealing with cyberbullying. They're dealing with bullying. They're dealing with all these things. And a joy patch would help them through some of that process of what's going on in their minds. You know what I'm saying? If it, we used to go to school and we could care less what we was wearing. But nowadays they go to school and they're getting picked on, which why they came up with uniforms in the first place, right? Mm-hmm. And now you're talking about, maybe they be talking about their shoes, whatever the case may be. But if they have a joy patch on, if they have on a peace patch, if they have on a focus, a lot of these different things that our children are dealing with, or even adults that we're dealing with, are these no ingredient patches with no side effects. Yes, there is a side effect. You feel better. That's the side effect. That you can put these patches on and go about your day. So in closing, I just want to say, and I'm going to give Hepzibah the opportunity to say as well, don't wait to try these patches. Don't wait till your doctor to give you approval. Don't wait until it's too late to try the patches. If it's coming across your timeline today, you know someone that could utilize these patches, get back with myself or Hepzibah, because listen, that's one thing we do. We move in integrity. If you know her, then I want you to contact her and hit her link up, right? If you know me, then you contact me and get my link. Or contact us. Let's talk about some more symptoms, because listen, we have 13 other patches. We have 13 patches that you can choose from, that 85% of what people go to the doctor for, we got a patch for it. Yeah. So why not patch, pray, connect with your doctors and therapists or whatever you're doing, and feel better when? Today. Hepzibah, give your last words before we close out.
You all have an amazing Wednesday, and be well.
And be well. All right. I love you to life. It ain't nothing you can do about it. Can't stop, won't stop. As I always say, if you don't love yourself, who will? We'll see y'all again next time on Wellness Wednesday. Love y'all. Signing out. Bye.